Hello, Peter. Thank you very much for giving the talk today.
You're welcome.
Can you please tell us a bit about the role of inflammation in depression?
Sure. So the background to it is that our current treatments for depression only really work for some people. They're not effective in others. Depression is a huge burden for society. It's very common, and in fact, it's the commonest cause of disability in adults worldwide. And women have that burden even more than men, no matter where you are in the world. So it's an important clinical question, and our current treatments are inadequate. Antidepressants are effective in some, they're not effective in others, and we need to find better treatments, and we need to understand what's going on in depression better than we do at the moment. Now, I don't for a moment want people to take away the impression that depression is only a problem with our biology or a problem in the brain, but that is a part of it. And one of the current best theories for what may be going wrong in depression is that there may be evidence of inflammation. So inflammation is when our immune system is activated, usually to something in the environment or to stress, and we can measure inflammation on blood tests. And what my research is doing is also looking for, is there evidence of inflammation in the central nervous system, in the brain of patients. And we use a particular brain imaging technique called positron emission tomography, or PET for short, to do that.
So what does this technique of PET tell us about the inflammation in people with depression?
Okay. So we've conducted a study in patients who are at least moderately depressed, so they're moderately or severely depressed. They're not on antidepressants at the time, and we've chosen a group of people so that we can exclude other possible causes of inflammation. So they're not overweight, they're not smokers, and they're all off antidepressants, because there's some evidence that antidepressants alter inflammation, they may suppress it. And when we measure their brain scans using PET and compare them to healthy controls who don't have depression and are otherwise healthy and the same age, we find that in the depressed group, there's evidence that a particular brain type called microglia, they are what's called activated. So when they're activated, they change shape, they become more mobile, they start releasing chemicals to get rid of whatever the inflammatory process is in the brain, and they contribute to the inflammation as well. They release chemicals which are what's called pro-inflammatory, they promote inflammation. And we measure that in PET by measuring the presence of one protein there called the TSPO. And in depression, there's evidence that in several brain regions, particularly a brain region called the anterior cingulate, a very important part of the brain for regulating our mood, that TSPO is elevated. There's more TSPO there, meaning there's more evidence for our microglia being activated, and we're concluding from that that there's evidence for inflammation in the brain of patients with depression compared to healthy controls. And in our study, we've replicated this finding from a previous study. So there are now several studies showing exactly the same finding.
And what other factors may be at play when we're talking about inflammation and mood and general health? So
there's lots of contributors to inflammation. Inflammation is like a final common pathway for a lot of factors contributing to it. Some of which come from our body, and some of which come from our environment, and some of which we do to ourselves. So a very common cause of inflammation is smoking. Smoking is a pro-inflammatory condition. Being very overweight is a pro-inflammatory condition. An unhealthy diet is pro-inflammatory. being sedentary, having no exercise, being inactive is pro-inflammatory. So there's lots of things in our environment and in our lifestyle which contribute to this. But the other pro-inflammatory condition that's very common is stress. And that could be work stress, relationship stress, stress of any cause. And not when it's just sudden and short-lived, but it's more that when stress is long-term. So when it's stress that you can't get away from, that you're living with day in, day out, whether it's overwork or whether it's unhappiness, this is pro-inflammatory and causes exactly the same changes in the body that all these other pro-inflammatory conditions cause.
And lastly, what can you tell about the clinical implications of this line of research and the understanding of the role between inflammation and
At the moment, the results of the research in this field suggest that there is evidence of inflammation in patients who are depressed, and you can measure that on blood tests, or you're now beginning to measure it on PET scans of the brain. But it'll only really become clinically relevant when we can understand it better and we can treat it. So there have been a range of trials, most of them not big, but there have been a range of trials looking at the effects of anti-inflammatory treatments on depression, because the standard drug treatments for depression so far have been antidepressants. Now we're looking at the addition of anti-inflammatory drugs to antidepressants to see, do those improve depression? And there's a whole range of them. Some of them are the sort of things you can buy over the counter, non-steroidal anti-inflammatory drugs. And others are very powerful biologic drugs that are only used in rheumatology clinics. But there's evidence that they can be effective in reducing the seriousness of depression in patients. And the field is moving toward designing and developing better anti-inflammatory drugs to add to antidepressants in the hope that our patients will get better still. What we don't have is any licensed anti-inflammatory drugs for depression yet, so the field is still in its infancy. But I think within the next decade, we'll be at the point of knowing who may benefit, which depressed patients may benefit from them, which are the best drugs for individual patients, and we'll know the exact extent to which anti-inflammatory drugs help depression, and I think that can only help our patients. I don't, again, want to suggest that this is the only thing we should be doing for our patients. Depression is not just treated by drugs, but I think we need to also rethink our environment. We need to think about smoking. We need to think about vehicle pollution. We need to think about diet, exercise, weight gain, and we need to think about reducing our relationship and work stress. So I think if we work toward a holistic reduction of stress, a reduction of inflammation, and potentially the addition of anti-inflammatory medications, hopefully we can make our patients a good bit better.
Thank you very much, Peter. Thanks for
You're welcome.